Have you ever stopped to think about how your body changes throughout life and how these often silent changes can impact your health and well-being? Today, we are going to talk about an essential topic that many people avoid out of shame or lack of information: changes in the vagina after the age of 60. This content has absolutely nothing to do with pornography. Here, our focus is on health knowledge and science. What no one tells you is that aging brings natural changes to the body that can directly influence intimate health. But don't worry, the purpose of this video is to show that these changes are normal and that there are simple and effective ways to take care of your vaginal health. At this stage of life, did you know, for example, that some traditional medicine practices used for centuries already had solutions for these changes, or that daily habits can make a huge difference in your quality of life? Stay with me until the end of this video because I will share science-backed tips and information that can transform your intimate health and self-esteem. Welcome to the Med Natural channel. Here we believe that information is health's greatest ally. If you're new here, subscribe now and join our community. We want you to feel comfortable learning, sharing, and growing. Today we will explore a fundamental topic for all women who want to age with health and well-being. I guarantee that by watching this video until the end, you will leave with valuable knowledge and a powerful natural tip to take care of your intimate health. Before we continue, I want you to comment below: I am a woman who takes care of my health. This may seem simple, but neuroscience studies show that when we commit publicly, our mind works to make it happen. So write this phrase as a commitment to yourself. Women's intimate health is an extremely important subject that still carries many taboos over the years. Especially after 60, a woman's body undergoes significant changes, including in the vaginal area. These changes are natural and part of the aging process. But few women receive clear and accessible information about what really happened and how to take care of themselves during this phase. Let's start with a few questions for you to reflect on. Did you know that estrogen levels, the primary female hormone, start to drop drastically after menopause, or that this reduction can cause physical and functional changes in the vagina, and that even so many women believe there's nothing to be done first? It's important to understand what happens biologically. After menopause, decreased estrogen can lead to a condition called vaginal atrophy. This means the vaginal walls may become thinner, less elastic, and less lubricated. These factors can cause discomforts like dryness, itching, and even pain during intimate relations. But take note, this doesn't mean a woman must resign herself to these changes. There are simple and accessible solutions that can significantly improve these symptoms, and don't think these changes only affect the physical aspect. Intimate health is directly linked to self-esteem, emotional well-being, and even quality of life. Many women avoid seeking help out of shame, or because they believe these issues are normal and have no solution. But we are here to change that perception. In ancient cultures, such as Ayurvedic medicine and traditional Chinese medicine, the importance of caring for intimate health throughout life was already recognized. Practices like massages with natural oils, the use of specific herbs, and pelvic floor strengthening exercises have always been part of women's care. And what's most interesting, modern science has proven the effectiveness of many of these traditional methods. In the next section, we will explore these changes in greater depth, understand the signs the body gives, and learn some practical and scientifically proven strategies for taking care of vaginal health after 60. Now that we understand the changes that occur in the vagina after the age of 60, let's deepen our knowledge and explore what science and ancestral wisdom have to teach us about dealing with these changes in a practical and effective way. What are the most common changes and their impacts? As we've already mentioned, vaginal atrophy is one of the most frequent changes. It can cause vaginal dryness, reduced natural lubrication, is one of the first signs of declining estrogen thinning of the vaginal walls. This can lead to greater sensitivity and even minor injuries during routine activities or intimate relations, decreased elasticity. The loss of collagen in this region makes the vagina less elastic, which can cause discomfort, changes in vaginal pH. The vaginal environment becomes less acidic, which can increase the risk of infections. These changes don't only affect physical health. The emotional impact is also significant. Many women feel embarrassed or avoid seeking help, which can lead to a sense of isolation. However, it's crucial to know that these changes are common and solutions exist, natural strategies to care for vaginal health. 1. Natural moisturizers and lubricants. Vaginal moisturizers with hyaluronic acid or natural oils, such as coconut oil, can be great allies in combating vaginal dryness. Uronic acid helps retain moisture and improves skin elasticity, while coconut oil has antimicrobial and moisturizing properties. 2. Pelvic floor exercises. The famous Kegel exercises, which involve contracting and relaxing the pelvic floor muscles, help improve blood circulation in the vaginal region, increase muscle tone, and can prevent urinary incontinence, which also becomes more common with age 3. Medicinal herbs. Phytocapy is a great ally. Some herbs like macot and ginger are known for helping balance hormonal levels. Herbs like chamomile and calendula can be used in sitz baths to relieve irritation or discomfort. 4. Balanced diet. A diet rich in anti-inflammatory foods and phytoestrogens such as flaxseed, soy, chickpeas and chia seeds can help minimize the effects of estrogen decline. 5. Massage with specific oils. In traditional or Vedic medicine, vaginal massage with oils like sesame oil or rose hip oil is recommended to hydrate and restore tissue elasticity. Additionally, this practice helps improve circulation in the region. 6. Alternative therapies. Vaginal laser therapy. A modern technique stimulates collagen production and improves vaginal elasticity and lubrication. Despite being a more technological method, it has proven effective with quick results. What does science say about this? Recent studies show that taking care of vaginal health goes far beyond physical comfort. An article published in the journal Menopause highlighted that women who treat vaginal atrophy report a significant improvement in quality of life and even mental health. Another study published in the Journal of Women's Health showed that the use of natural lubricants and the practice of Kegel exercises are as effective as some medical interventions in alleviating the symptoms of vaginal atrophy. Furthermore, research conducted by Harvard University demonstrated that women who maintain a diet rich in antioxidants and phytoestrogens experience fewer symptoms associated with menopause, including vaginal discomforts. How to start implementing these practices in daily life. Dedicate 10 minutes a day to perform Kegel exercises or even a simple massage with natural oil. Include foods rich in phytoestrogens in your diet. Try adding a tablespoon of flaxseed to breakfast or a handful of chia seeds to a smoothie. Set aside time for self-care. Schedule a relaxing sitz bath once a week with herbs like chamomile or cula. The most important thing is to understand that every body is unique. What works for one person may not be ideal for another, but with patience and self-care, it's possible to find practices that bring more comfort and well-being to your body. How to avoid recurring problems after menopause. The vulnerability of the vaginal area increases, making it essential to adopt specific care to prevent infections, discomfort, and other issues. Here's how this can be done. Maintaining a balanced vaginal pH with the drop in estrogen. The vaginal pH tends to become less acidic, creating a more favorable environment for harmful bacteria. To prevent infections, prefer neutral or intimate specific soaps. Use probiotics designed for vaginal health, such as those containing lactobacilli. These microorganisms help maintain the balance of the vaginal flora. Choosing the right clothing. Tight clothing, or those made from synthetic fabrics, can increase moisture and heat in the intimate area. Promoting infections, opt for cotton underwear and avoid prolonged use. Use of wet clothes, such as swimsuits. Practicing balanced hygiene. Excessive cleaning can be just as harmful as poor hygiene. Avoid vaginal douches, as they can alter the natural flora of the vagina. Clean only the external vulva area with gentle products and warm water. Engaging in regular physical activity. Moderate physical activities help improve blood circulation throughout the body, including the pelvic region. This promotes vaginal tissue health and contributes to collagen production. Scheduling. Regular checkups, seeing a gynecologist regularly, is essential. Preventive exams help identify any changes in vaginal health, allowing problems to be addressed before they become serious. A powerful practice, the rejuvenating sitz bath. The sitz bath is a simple yet highly effective technique that combines the use of natural herb to relieve discomfort and restore vaginal health. Here's how to prepare it. Ingredients: 2 tablespoons of chamomile dried or in tea bags, 1 tablespoon of calendula, warm water enough to fill a basin. Instructions: boil 1 liter of water and add the herbs. Let it infuse for 10 minutes. Strain the mixture and pour it into a basin with warm water. Sit comfortably in the basin for 15 to 20 minutes, relaxing and allowing the herbs. Properties to act on the intimate area: benefits: relief from dryness and itching, calming and anti-inflammatory action, stimulation of local blood circulation. This practice can be done once a week and is an excellent complement to daily intimate healthcare myths that need to be debunked. Unfortunately, many myths still surround vaginal health, especially after 60. It's important to dism these ideas so women feel more confident and informed. It's normal to feel pain during sexual intercourse and nothing can be done. This is not something you need to accept as part of aging. With proper care, like using natural lubricants and doing pelvic floor exercises, it's possible to significantly improve comfort. Menopause ends libido. Not necessarily. While hormonal changes can affect sexual desire, factors like emotional health, self-confidence, and intimate care play a crucial role in libido. There's no need to care for vaginal health after 60, quite the opposite. Caring for intimate health during this phase is essential to ensuring physical and emotional well-being. The connection between vaginal health and overall health. Vaginal health is deeply connected to a woman's overall health. For instance, women with untreated vagina atrophy are at a higher risk of recurring urinary tract infections. Vaginal health issues can directly impact emotional health, causing anxiety or low self-esteem. An emotional perspective. Taking care of intimate health goes beyond the physical. It's about self-care, self-esteem, and acknowledging the importance of your body at every stage of life. By implementing these practices, you not only improve vaginal health, but also strengthen your connection with yourself. Wrapping up, and a final message: throughout this video, we've explored the natural changes that occur in the vagina. After 60, uncovered the impacts of these transformations and shared practical and effective strategies for maintaining intimate health. Now let's recap the main points, answer some questions, and highlight how these changes can be viewed positively. Summarizing what we've learned. Natural body changes. The reduction in estrogen during menopause can lead to vaginal dryness, loss of elasticity, and changes in vaginal pH. These changes are common and part of the aging process, but they don't have to be ignored or faced without solutions. Care strategies. Adopting practices such as using natural lubricants, doing Kegel exercises, and massaging with specific oils. Balancing your diet with foods rich in phytoestrogens and antioxidants. Utilizing traditional techniques like herbal sitz baths for relief and continuous care. Importance of self-care. Caring for intimate health isn't just about avoiding physical discomfort, but also about promoting self-esteem, confidence, and overall well-being. Answering key questions. Do these changes mean I can't have an active sexual life? Absolutely not with the right care. It's possible to maintain a satisfying and comfortable sexual life, communicating with your partner and seeking methods to enhance comfort, such as lubricants and hormonal therapy, if recommended by your doctor, are essential. What if I feel embarrassed to seek medical help? Remember, your gynecologist is there to help. These changes are normal and part of every woman's life. The sooner you seek help, the quicker you'll find solutions to improve your quality of life. Do natural practices really work? Yes, scientific studies support the effectiveness of many natural practices, such as using probiotics, consuming foods rich in phytoestrogens, and massaging with specific oils. The key is consistency and combining them with healthy habits. The positive impact of changes. Looking at your body's changes with acceptance and care is transformative. Acknowledging that aging brings challenges, but also wisdom allows you to approach this stage with more ease and self-love. Caring for intimate health isn't just a physical act, but a gesture of respect and gratitude for your body. A special closing message. Intimate health reflects how you care for your body and mind. By applying these tips and strategies, you not only improve your quality of life, but also inspire other women to do the same. You've taken an important step by informing yourself about the changes in intimate health after 60, and how to care for yourself during this stage of life. Knowledge is a powerful tool, and by applying it, you're investing in your quality of life, well-being, and self-esteem. Here on the channel, we believe that every woman deserves to age with health, confidence, and fulfillment. This video is just the beginning. We have many more contents that can transform your relationship with your body and bring more balance to your life. We recommend watching the 2 complimentary videos that will appear on the screen at the end of this content. Before we close, I want to leave you with a special message. Self-care isn't selfish. It's an act of love for yourself. Taking care of your intimate health is taking care of your essence, and that should be a source of pride if you've made it this far. Write in the comments, I made it to the end, and I am a woman who takes care of herself. This shows your commitment to your health and inspires other women to do the same. Once again, congratulations on your dedication. Keep following the Med Natural channel for more life-changing content. See you in the next video for